Welcome everyone to your very first step into the fascinating world of biochemistry. If you are just entered MBBS, you might have heard biochemistry is tough and it's full of pathways. But here is the truth. Biochemistry is not about mugging up. It's about understanding life at a molecular level. In this session, I'll help you understand what biochemistry actually is, how to study, theory as well as practicals, how to revise effectively before examination, and how to use previous year university papers to boost your marks. Let's begin your biochemistry journey the right way. Biochemistry is a chemical basis of life. If you go by definition, biochemistry is a study of biomolecules, their structures and reactions that they are undergo inside the cell. In anatomy, you will study the structural organization of the human body, understanding the precise location, form, and relationship of various organs and tissue. In physiology, you will explore the functional aspect, how each organ system operates and coordinates to maintain homeostasis. And in biochemistry, you will learn the molecular and cellular mechanisms that underlie these physiological processes. From biochemistry perspective, when all the cellular reactions occur in a complete harmony and balance, it represents the state of health. However, when any of these reactions are disrupted or fail to occur properly, it leads to disease. So biochemistry serves as a bridge between physiology and pathology. In other words, biochemistry helps us understand why and how a normal physiological process goes wrong at a molecular level, ultimately leading to disease. To identify such abnormalities, we perform various biochemical tests. These tests are broadly classified into two categories: qualitative and quantitative. The qualitative tests help us detect the presence or absence of specific biomolecules, while quantitative tests measures their exact concentration or level in the body fluid. Together, these form the practical foundation of biochemistry, bridging laboratory findings with clinical diagnosis. So while physiology explains how the body works and pathology explains what goes wrong, biochemistry explains why it happens, right from the level of molecules, enzymes, and metabolic pathways. Now students, biochemistry can be divided into four major sections. Chemistry part. This is the foundation of biochemistry. Here we study the structure, properties and functions of the major biomolecules: carbohydrate, proteins, lipids and nucleic acids. You will learn what they are made up of, how they are arranged and what are their functions. Second part is metabolism. Once you know the biomolecules, the next question is what happens to them inside the body. That's where metabolism comes in. Here we study how these biomolecules are synthesized, that is anabolism, how they are broken down, catabolism, to release or store energy. You will also learn how all these pathways integrate with each other. For example, how carbohydrates metabolism connects with fat and protein metabolism. Third is clinical biochemistry. Now this is the applied and diagnostic aspect of biochemistry. For example, liver function test, renal function test, diabetes, cancer, etc. And other topics are enzymes, vitamins, minerals, hormones, nutrition and techniques. Why students struggle initially? Students struggle because they try to memorize pathway without understanding the flow. They also tend to ignore clinical relevance, forgetting that every pathway they learn has a real life application. For example, glycolysis connects to energy production and its defect causes lactic acidosis. Instead, focus on logic, understand why the reactions happen. Flow, see how one pathway connects to another. Know what happens if something goes wrong. That's where clinical cases come from. Most common question students ask is, Sir, how should I start studying biochemistry? Begin with the basics. Start with the major biomolecules, carbohydrate, proteins, lipids, and nucleic acid. Understand first chemistry part. Focus on concept, not on memorizing lines. Visualize their function inside the cell. Connect the topics in a logical flow. Never study topics randomly. First, learn structure, then its function, then its metabolism, and final clinical relevance. For example, learn the structure of glucose, then how it's broken down, glycolysis, then finally how defects in this pathway causes diabetes. This way, your understanding becomes complete and integrated. Use diagrams and mnemonics, the one-page strategy that I follow personally. Biochemistry is full of reactions and pathways, but instead of memorizing, you should visualize everything on one page. This makes revision faster. Here is how you design your one-page biochemistry sheet. Center of the page, write main pathway. On top left corner, write rate limiting enzyme. On top right corner, write energy yield or cofactors or regulation. Bottom left corner, write inhibitors and activators. Bottom right corner, write clinical correlations, write important diseases related to this pathway. And in margins, write mnemonics and tricks. Now, how to do university paper practice? Before exam, dedicate at least 2 hours daily to solving previous 3 to 5 years university papers. Identify repeated questions. Write short, structured answers. Practice time-bound writing. Mark topics that appear every year. Those are your must-know zones. Common mistakes to avoid. Blind memorization of pathways. Ignoring clinical connections. Delayed revision. Studying from too many sources. Instead, stick to one standard textbook, one review book, and your notes. Revise weekly and test yourself often. Now let's talk about the practical aspect of biochemistry. In your university practical examination, you will be assessed mainly in two types of tests: qualitative tests, quantitative tests, as we have discussed earlier. Next, you will have to maintain a biochemistry practical journal, which contains all practical procedures and results, interpretations of biochemical findings. Apart from the journal, you will also maintain a biochemistry logbook. It is different. It records your competency based learning activities. It has two important sections. One is early clinical exposure. In this section, you will visit the hospital and correlates biochemical findings with real patient cases. For example, a patient with diabetes, you will learn about glucose metabolism and lab diagnosis. A case of jaundice, you will link it to bilirubin metabolism and liver function test. The purpose is to understand how biochemistry applies in real clinical practice. Second is AETCOM module, Attitude, Ethics and Communication. It teaches you how to communicate, behave and make ethical decisions as a future doctor. There are four main AETCOM modules. Questions often come directly from these four topics, so make short theory notes from each. Now finally, let's talk about one of the most important questions. Which book should we follow for biochemistry? Honestly speaking, all standard books are good, but let me simplify it for you. First is Harper's Illustrated Biochemistry. This is considered the gold standard textbook worldwide. Use it as a reference book. Second is D.M. Vasudevan. This is one of my personal favorite and the most student-friendly Indian author book. It explains concepts in a simple language with clear clinical application and case-based discussion. Next is Lippincott Illustrated Biochemistry, another excellent book, especially if you like visual learning. Each topic is presented with beautiful diagrams, charts, and summary boxes that makes memory retention easier. Other books are also good like Satyanarayan, Rafi, Indumati and Saubhagya Lakshmi, S.K. Gupta, etc. So my message to every first year student is simple. Biochemistry is not a book to memorize. It's a story to understand. If you follow this plan and roadmap sincerely, you will not just pass, you will master the subject. Remember, medicine begins at the molecular level. It begins with biochemistry. Thank you for watching and all the best for your first MBBS journey.